Just so you know, there's another lab practical going on next door that's also anatomy one in here. So I don't know what models I'm going to have available to me. I try to get here early so I get the models that I like, but I don't always have them available. So I want to show you these structures on just the different possibilities of the brains. The one I like the most, and this is the one I'm going to try to use next week, is this one over here because it has got a nice color coding to it. So take a look at the top of page, lab number 14, excuse me, on page 1. Let me just show you real quick the regions of the brain that we're going to go over. This big part right here, like the cap of a mushroom, this is the cerebrum, right? So this whole big part here is going to be the cerebrum. If I take the cerebrum apart like this, kind of in the middle, like right about here, I'll show you that in a little bit specifically, this is the area called the diencephalon. We'll see that anything that has the name thalamus is going to belong in this region. So the cerebrum is this whole big region. This is going to be the diencephalon. Then, let's make it back together. Then, this part right here, it's kind of like the stalk of a mushroom, like right here, this would be the stalk of the mushroom cap. This is going to be called the brain stem. So the brain stem is like a stalk of a mushroom, and then the cerebrum is the kind of the cap of the mushroom. The last part we're going to go over today, guys, is this part right here. This here is called the cerebellum. When the anatomists looked at it, they thought there was two brains, a big brain and a little brain. Cerebellum means the little brain. So this right here is the cerebellum. All right, so those are the main regions. So let's start with number 2. Let's do the cerebrum first. The first thing I need you to be able to differentiate is this. In order for the brain, which is billions and billions of neurons, to fit in our cranial vault, it's got to be kind of like scrunched together. So we're going to get these outward folds, like right here, this outward fold, all these things that kind of look worm-like, all these outward folds, these you're going to call a gyrus. So an outward fold is a gyrus. All of these kind of like worm-like. Okay, so that's an outward fold. On either side of an outward fold is an inward fold. That depression where the fold goes in is a sulcus. Okay, outward fold is a gyrus in the brain. An inward fold is a sulcus. Any questions on that? Okay, good. Let me steal. I still want to bring the part over here. Just one other thing I want to show you. Number 2, differentiate between a superficial cortex and the deeper white matter. If you look back up over here for a minute, the gray matter is deep and the white matter is on the outside, kind of around. When we get to the brain, it's the opposite. When you're touching the cerebrum, if you were touching a real brain like this is actually all gray matter. The white matter is deep. It actually switches places. And I'll just show you real quick on here, because this breaks apart. Usually when I want it to, it doesn't. We kind of just looked at the cerebrum here. The outer edge is kind of where they have it painted kind of orange or tan, but this is all gray matter. And then here, see how this is whiter? The white matter is deep. So you should know, though, in the brain, the cerebrum especially, the gray matter is superficial, and then the white matter is located deep to it. It's the opposite of the spinal cord. In the spinal cord, the gray matter was deep, the white matter was more superficial. Okay? The gray matter we call the cerebral cortex, or the superficial cortex, and the deeper white matter. Any questions on that? Okay, that's kind of an easy concept. As far as the cerebrum, there's a left side. We're going to call this the left hemisphere. This one's going to be the right hemisphere. The deep groove, guys, right here that separates the left hemisphere from the right hemisphere, that's my neck structure. That groove, if I put a card in there, is called the longitudinal fissure. It's like right under the sagittal suture. Remember we did the sagittal suture right here between the two parietal bones? It's right underneath there. So this is called the longitudinal fissure. Next week on a test, this is how I ask it. If I ask it, I don't always ask it, I ask other fissures too. But if I was going to ask the longitudinal fissure, I'll put a card on there and I'll put a number, question number 10, let's say. Identify the structure or the groove, right? That's how I mark that I want you to put down longitudinal fissure, okay? Within the longitudinal fissure, this is what happens. Remember we have the meninges around the spinal cord? Those same three meninges, the dura, the arachnoid, and the pia, they're around the brain too. But watch this. There is an extension of the dura mater that covers here that goes down into the longitudinal fissure to kind of stabilize the brain. That is my next structure under longitudinal fissure, guys. See that thing that says falx cerebri? That is a piece of meninges, dura mater actually, that goes down into the longitudinal fissure. So I just want to show you the model that shows that is this. Joe, hold that for a second. You have to hold that cerebellum on there too for me. Thank you. You can hold it comfortably. What they have here, guys, this is the sagittal suture. This is the left parietal bone, the right parietal bone. So the dura mater is kind of up right here against the parietal bones. Then this extension that comes down right here, this is the falx cerebri. It sits inside that longitudinal fissure. It doesn't fit this model, but this should, if we kind of put this all together, this should sink right into there. Can everybody kind of visualize that? Just to show you what you know already, this little point here of the falx cerebri actually attaches, remember the crista galli, that little cone that's stuck up from the ethmoid bone? That's what this attaches to. So this actually attaches to the crista galli. This whole thing here is the falx cerebri. You can cross off superior sagittal sinus, inferior sagittal sinus, and the straight sinus. If we had another week or so, I would teach those. Those are major veins inside the falx cerebri. See these blue lines right here? These are veins that drain blood from the brain. You'll learn those next semester. I'm not going to hold you responsible for this semester. So on a test, if I said identify this structure here, falx cerebri, falx cerebri, right? It's going to be located right in the longitudinal fissure. There's another fissure, number 5. Watch this. If you look at the back of the brain, this was the cerebellum before. This is a part of the cerebrum called the occipital lobe. It's right by our occiput bone. It's kind of this area here. So watch this, guys. The fissure that separates the occipital lobe of the cerebrum from the cerebellum is this fissure right here. That is called the transverse fissure. What does transverse mean?
Across.
Across. It's going across, right? So it separates the occipital lobe from the cerebellum. Okay, so that's the transverse fissure. This was the longitudinal fissure, transverse fissure. Okay? This also has an extension of the dura mater sticking in there. It would actually go in like this. So watch this, and I'll show you on that model. This dura mater in that transverse fissure covers the cerebellum. So they call it the tentorium cerebelli, and I have that written down for you. Tentorium means to tent over or to cover. It's actually a great name. So on this picture here, guys, this thing here, that's the tentorium cerebelli. It fits right in the transverse fissure. So if my fist here was the cerebellum, see how it covers or tents over the cerebellum? So that's why they called it tentorium cerebelli, right? If you had a tent in your backyard, it's a tentorium. That's just the Latin name for it. Okay? This will be one station. What's this? This is the falx cerebri. What is this? Everybody, falx cerebri. This is the tentorium cerebelli. What is this? Tentorium cerebelli, right? Tentorium cerebelli. Okay? All right. There are many sulci or grooves in here. There is one important one that I need you to know, just because clinically it's just so important. Watch this. Before I show you the sulcus, just to kind of go over the lobes as a preview. This whole front part here of the cerebrum is called the frontal lobe. This part right here from the blue to the green, this area here, parietal lobe. So this sits under the frontal bone. This kind of sits under mostly the parietal bone. Back here, what lobe do you think this is? Occipital lobe, right? Then there's a lobe right here. This thing kind of goes on sideways this way. This is the temporal lobe. Okay, so we have frontal, parietal, occipital, temporal lobe. So watch this, guys. There is a groove that comes up. Watch this, from the side of the. Oh, I stole I stole this. Do you need it back?
No,
okay.
I wanted you to have that just in case you want to show them.
Oh, that's nice. Thank you. That's so good. There is a groove that comes up the side of the brain here between like the frontal lobe and the parietal lobe. See this groove right here? It comes up over this way and then it goes down on the other side. So it's pretty much in the middle of the brain. So they decided to call this sulcus the central sulcus. I need you to know that one. I'll try to use this model, but like I said, Professor Costa's having a test next week too. There's not that many of these, so you need to be able to find it on the other models also, but it's between the red here and the blue. It's called the central sulcus. Okay, it's pretty much in the middle of the brain. Now, associated with the central sulcus, there are two gyri that I need you to know. Let's do this front one first. In front of the central sulcus, there is this gyrus. See how big this thing is? This is called the pre-central gyrus. Pre-central gyrus. What does pre mean? Before, right? So it's before the central sulcus. That's why they named it that. It's actually a good name. Here's what I want you to know about this, guys. All of your voluntary motor movements, everything you do, like me even holding this stick right now, this starts on your pre-central gyrus. Every voluntary thing that you do, all your motor movements begin here. For instance, watch this. This part right here, you don't have to know this. This would be like your hips and your legs. So let's just say I want to bend my hip like this, right? That started here. Me holding the stick is about here, right? My jaw moving and talking and all that, that's about here, let's say. So when somebody gets a stroke, watch this. Say that the neurons here are damaged, they're going to be paralyzed in the leg. If they get damaged here, their arm is going to be paralyzed. If they get damaged here, they may not be able to speak. So depending on where the precentral gyrus, the damage is, will determine what symptoms the patient has. Right? And again, you've probably all seen patients that have had strokes. Some can't move their arm, some can't move their leg, some can't move both, some can't speak. It all has to do with where on the precentral gyrus it was damaged. Some people call this, and I think I have it in your notes too. Do I have there? It's called the primary motor area. Right? That's the primary motor area. Again, all of your voluntary movements initiate right here. Okay? Central sulcus, precentral gyrus. The other gyrus I want you to know is the blue one right here, guys. This is called the post-central gyrus. Post-central gyrus. What does post mean? Pre is before. Post is after, right? Post is after something happens. So this is the post-central gyrus. So here's the opposite. Watch this. All of the sensory information coming up from your body, right? Everything that's coming up, touch, pressure, hot, cold, pain, all these things that are coming up from your body, they end up here, and this is where you perceive those sensations, right? If I took this pin, let's say, and I touched Joe on the shoulder, say it was sharp, you feel that touching you? She's perceiving that right about there. She felt that stick touching her. She was able to perceive it. If you touch that hot cup of coffee or that hot pot, right, you'll perceive that here. So this is the motor side, this is the sensory side. Let's say somebody has a stroke and it happens here. This is also the hip region. So they would lose sensation in the hip and the leg if they had the stroke right there. They would lose sensation in the arm if it was here, let's say. Okay? So this is the motor side. This is the sensory side. Precentral gyrus, post-central gyrus. What's the sulcus in the middle? Central. Okay, central sulcus. Right. So just so you know, it's easy on this model because it's red and blue. like I said, guys, it's not always there. On this model, this is the frontal lobe here. You can see this sulcus. It goes up one side and then down the other. That's how I usually look for it. This would be the precentral gyrus here, postcentral gyrus there. So you can see it. They make it so it's a little obvious here. It's just not color coded. So, like I said, I'll try to get here real early next Monday, so I at least have a couple brains like that color. We're good? Okay. That's an important little section there. Just clinically, it's important, especially for those of you going on in your studies. We deal with that all the time. Next semester, if you're going on into AMP2, you'll actually learn the blood vessels that supply that area, like the middle cerebral artery is the one that most commonly gets damaged for a stroke, and that's why those regions are damaged. So we'll add more to that in the next semester as you go on. Okay, any questions 1 through 6? Pretty easy, right? So let's do number 7. This one is less important. I was actually debating about taking it out. I think maybe next semester I'm going to take it out. There is a sulcus, clinically less important, between the temporal lobe here and the frontal lobe and the parietal lobe above. So this sulcus right here where my stick is, lateral sulcus. All right, so my stick right there is sitting in the lateral sulcus. Okay? Temporal below, and then the frontal and the parietal above. There are how many cranial nerves? How many pair? 12 pair, right? You only need to know, again, if I had another week, we'd add them. You only need to know 2 for me. So watch this, guys. Watch what we're going to do. We're going to take the brain, we're going to turn it upside down. Well, actually, before I even do that, watch this. If we looked at the frontal lobe here, this is where your nasal cavity would be. So there's a nerve right above the nasal cavity. This is going to be olfactory nerve or cranial nerve number 1. Look at it. This is the one on the right brain. This is the one on the left brain. It looks like the number 1, right? It's telling you I am nerve number 1. Looks like that. It has 2 parts. This swelling at the end is called the olfactory bulb. It's the little swelling at the end. And that leads to this part right here, olfactory tract. So next week, watch what I may say. If I say identify the specific structure, olfactory tract. If I say identify the nerve, I just want cranial nerve number 1. You got to read the question, kind of like what we did last week when we took the test, right? Olfactory tract. What's the end going to be? The swelling? Olfactory bulb. Looks like an old-fashioned light bulb, right? That type of thing. What's the nerve? Cranial nerve number 1, or the olfactory nerve. What does olfaction mean? What is that sense? The sense of smell, right? So your nasal cavity here, let's say you smelled that nice hot chocolate that you made after you burned yourself, right? Those fumes of the hot chocolate go into your nasal cavity, right? The sensory nerve, olfactory nerve number 1 is right above it. It's going to send the signals, believe it or not, right to your temporal lobe. This is where you perceive smell. Right? So whatever you smell, you're perceiving it over here. Okay? Let's put this into perspective. Your left eyeball would be here. Your right eyeball would be over here. So, to the back of your eyeball is cranial nerve number 2, which is the optic nerve. That's the second one that I want you to know. So this is right here, guys. This is the right optic nerve, left optic nerve. It goes right into it. We put the eyeball right here, the eyeball there. It goes right into the back of the eyeball. So what you're seeing right now, you're looking at this model, you see me, you see the room, you see everybody else. All that information is going into the optic nerve or cranial nerve number 2, okay? One interesting thing about it, I think anyway, take a look. The right optic nerve, once it heads back to the brain, it goes over to the left side, and the left optic nerve goes over to the right. So right here, I'm going to show you guys like this first. That crossing right there is called the optic chiasm. It's where the left optic nerve crosses to the right, and the right optic nerve crosses to the left. So what you're seeing in your left eye, what part of your brain are you perceiving it is your right. Your right eye, you're perceiving it on your left. We just don't have the time. I wish we had another week or so. Everything crosses. Even that gray commissure up there, things are constantly crossing. You tell me, when somebody has a stroke on the left side of their brain, what side is paralyzed? Right. The right side, right? When they have a stroke on the over here on the postcentral gyrus, they can't feel, even the left side, they can't feel on the right side everything, or 99% of everything crosses. And I'm not really sure why that is, but there's just a lot of crossing in the body. So next week, if I said to you, identify the nerve, optic nerve or cranial nerve number 2, what's it allowed for? Vision. This would be the right optic nerve. This would be the left. What's the crossing called in the middle? Optic chiasm, we pronounce it. You could say chiasm, that would be okay, I've heard that too. We typically say chiasm. In Latin, the chiasm is a crossing. All right, chiasm is a crossing. Okay? Any questions on that? Like I said, there's other cranial nerves here as you go on in your studies, but we're just short of time, so we're just gonna have you know the main 2. Anybody questions or comments on that? Beautiful. Okay. I went over the lobes. I just want to go over what they do because I could ask you next week what the functions are. So watch this, guys. From the central sulcus forward, this is all what lobe? Frontal lobe. Here's what happens here. Planning, right? You're planning on passing this course. You're planning on becoming a nurse. You're planning on getting married. Planning on having a baby. All the things that you're planning, guess where that takes place? Frontal lobe. Concentration happens here. Watch people when they concentrate. What do? They're like, what are they stimulating? Their frontal lobe, right? They're thinking, the thinker. It's like, all that, oh, what's the answer? You're stimulating that frontal lobe because that's where it helps you to concentrate. Personality happens here. Years ago, they would do something called lobotomy. They take a little ice pick, right through the orbit. They would go in and they would take the ice pick and just destroy the frontal lobe. And you ever watch somebody that after they had a lobotomy, have like a sexually deviant person or whatever, and they'd be like, afterwards, they had no more personality, no more affect. It was all gone because your personality was here, so they would destroy that frontal lobe to get rid of that abnormal behavior, that type of thing. And then again, the precentral gyrus is there, so it's responsible for your motor movements. All right, so it's an important lobe. So if I said to you next week, give me one function of the frontal lobe, you could pick any one of those. I would always pick like concentration, because I was thinking people are going like thinking and trying to concentrate. Planning, personality, all that's it. The parietal lobe, is that the second one I have? So this is more of a sensory lobe, guys. This is where you do a lot of perception as far as what you feel on your body, especially like the postcentral gyrus right here. So this is an important perception right here. The big one in the occipital lobe, vision, right? Everything you perceive for what you see, you're perceiving back here. So this optic nerve here ultimately makes its way all the way back to the back of your head. So this is one of the reasons sometimes when people hit the back of their head like this gets destroyed, they go blind. Nothing wrong with the eye, nothing wrong with the optic nerve, but where you interpret what you see, that becomes damaged, right? That was the occipital lobe. Temporal lobe over here, oops, I'll show you the colored side. Think of mostly hearing, smell. Now some people say taste here also. I'll show you real quick without trying to break this apart too much. Joe, hold on to that for me. Bear with me 1 minute, guys. I probably won't ask you this last lobe called the insula because it's such a pain in the neck to get to. There is a lobe of the cerebrum. It's funny, when I want it to fall apart, it won't. Okay, I'm gonna try to keep this like this. So watch this. If I drop the temporal lobe down to make the lateral sulcus bigger, see that orange right there where my finger is back there? That orange lobe back there, that is called the insula. You can only see it if you take that temporal lobe away. You kind of have to separate the two here. That's where taste is perceived. So some people, some textbooks as a matter of fact, they don't even mention the insula. It's kind of like it's part of the temporal lobe. So just kind of know there's an insula, it does taste. On the test, I wouldn't ask you to identify it, but I could ask you in theory, what does the insula lobe do? Taste, okay? Any confusion on that? Okay. Any questions on that first page, guys? So these are the things I need you to identify and Whatever I gave you functions of, know the function. Okay. You know what? You can put that there. We'll get to that in a minute. So, those were the main things for the cerebrum out here. The next couple structures, 11 through 14, these you're going to see on the inside. So what you would have to do if we had a scalpel, right, if this was a real brain, we would cut through the, what fissure is this? What's the fissure? Longitudinal, right? It's going the long way. Longitudinal fissure. That's the longitudinal fissure. We would have to cut that, and we're going to open it up and look at it like this. So, let me show you the parts, the 4 parts, and then I'll kind of tell you a little bit about what they do. This first one is real easy. This big C-shaped thing right over here, this is called the corpus callosum. Right, so that big C-shaped thing is the corpus callosum. Then watch this. This little white thing right here running across, it's usually a bright white because it's actually nice, it's a track, it's white matter. This is called the fornix. Oops, fornix. Right, so corpus callosum and the fornix. In between the corpus callosum and the fornix, this membrane right here, we're going to call the septum pellucidum. Septum pellucidum. What's the last thing I have on there? I took so much stuff out, I don't remember. Anterior commissure. Bear with me one minute.
That's a septum.
You know what, guys? Strike that. I meant to take that out. This lab, this would be so much longer. I took a lot of stuff out. Strike out anterior commissure. I'm not going to get you that. So let me give you some perspective as to what this is. The 3 structures that I have so far. I'm going to put this back together for a minute. Show you real quick. We're going to go over this a couple times this morning. But just to show you real quick, here's a picture of that insula. See how they took some forceps and they kind of separated them apart, 3 trackers. I mean, this is the insula on the inside. So this is a picture from your book. This is the stuff we're going over now: the corpus callosum, the fornix, and the septum pellucidum. But I want to put into perspective my descriptions. Right here. In our brain, this is actually a good picture. Here's our brain. Inside, kind of watermarked in here, there is a system of hollowed out areas. These are called the ventricles. So, like this big C shape here sits in this cerebrum here. This other one sits in the other ones, in the other cerebrum. So if you cut the brain, it wouldn't be all solid. There's hollowed out areas inside of here. So this is what I want to show you. I'm going to leave that picture up there. Here we go. This is a model of what I have up there that would sit